We have 5 facets and they need to work together. We're a small organization. So we organized the society, the board, the program directors, that also included the research foundation and the journal into one uniform voice.
I was put on the American Board of Colorectal Surgery. And I went to my first examination in New Orleans. And I recall that we examined only 6 people. So I was sitting in the airplane getting ready to take off from New Orleans. I took out my yellow pad and I said, you know what we need are more training programs.
It was a little bit, for lack of a better word, a little bit of the wild, wild west. Programs were in existence as early as in the 30s and 40s. And through the 50s and 60s and into the 70s, as the specialty grew and as the number of programs grew, there were informal meetings at our annual society meeting, the American Proctologic Society at that time.
Well, that meeting in Florida resulted in the formation of the Program Directors Association.
The ASCRS and the board, the American Board of Colon and Rectal Surgery, decided that we really needed a central place for all the program directors to come together. So with their support, the APD-CRS was born. It was decided in 1979, officially started in 1980, and the first president was Dr. Stanley Goldberg.
We finally got it so that the program directors, we could set the date that people could apply and things started to happen. The other thing that I pushed for was the fact that these training programs should be primarily at universities, tied in with universities. The Mayos and the Cleveland and the Oxner and the Leahy Clinic were all instrumental in getting us started. The quality of people coming into colorectal surgery today, I mean, when I look at the curriculum vitae of the people who are applying to the University of Minnesota, they never would have let me in the door today.
We only have about 66 programs in colorectal surgery, and we graduate just over 100 fellows per year. And so all programs, regardless of how big or how small, have to do all the same things to get their residents ready to go on to the next phase and be good for practice. The job of the Program Directors Association is to set the curriculum, to decide what is most important, and to help standardize that across the 66 programs. And then the final step is the Board of Colon and Rectal Surgery, the ABCRS. Their job is to certify that, yes, indeed, our fellows have met all requirements and they're good to go out and practice and represent us well.
The RC is the group that accredits colon and rectal surgery programs today.
To make sure that every trainee is hitting all of those requirements, whether it be case logs or the type of diagnoses that they're treating, that they're learning all aspects of those 6 core competencies that are required in any residency. Those include professionalism, communication, medical knowledge, systems-based practice, practice-based learning, and patient care. Colon and rectal surgery has its own RRC, and it's made up of elected members, and those members come from AMA, from the APD-CRS, from the board.
Both the Program Directors Association and the Review Committee actually serve as great resources for any institution that wants to start a program.
They've had several iterations of the curriculum in colon and rectal surgery, and every program draws upon that.
They work on curriculum. They work on evaluation and assessment and teaching methods. Where the ACGME, they are the group that puts out, and the RC puts out the program requirements, which a specific program has to meet in order to be accredited. And ultimately, for a candidate to sit for the boards, they have to graduate from an accredited program.
Residents need to be evaluated by their patients, by their peers, by nursing staff and ancillary staff, in addition to, of course, their faculty and their residency program director. And all of those are sort of centrally housed within the APD-CRS. And it is such a wonderful opportunity for a group of people to come together and discuss what it's like to be the program director. APD-CRS really began as the brainchild of the board and of ASCRS. They were visionaries back in 1980. They thought this was important and they brought it to fruition. And over the course of the last almost 45 years, we've watched this grow. And as one colorectal came to fruition, it has been really fascinating to see the interplay between all of the organizations. Sometimes the program directors are seeing something ahead of the ASCRS or ahead of the board, almost like a canary in a coal mine, and they're able to see it and get out in front of it and help shape the quality of our graduates in colon and rectal surgery. Back in the 2000s, when laparoscopy was coming about, they all came together and developed a laparoscopic workshop for all of the residents. Well, they're all skilled in that. There's no need to continue that. So the concept is now a workshop for robotic surgery for all of the fellows to make sure that everyone is getting a nice introduction and keeping all of our patients safe when they go out into the world to practice.
Right now, at the RC level, we are in the process of rewriting the program requirements for colon and rectal surgery training programs. We've started that process. And just this past month at our one colorectal meeting, I updated everyone on that. I got feedback. It really allows for a two-way communication so that everyone, gets their voices heard and allows to have input in the various processes that are going on, whether it's the society, the board, in this case, the review committee, or the Program Directors Association.
Being able to share the concerns and to share the successes and the wins of our residents and our programs across one colorectal, I think it strengthens the society, the ASCRS, and it strengthens our field as a whole.
We have to ensure to the American public and the patients that we serve that the quality of our trainees and the education that we provide them is of top quality, and when they graduate our programs, that they are competent to, practice in the field of colon and rectal surgery and to serve the patients.